The Calling Out the Shots podcast is dedicated to compassionately looking for the truth in a world full of division and lies. Humanity has not been allowed to speak freely for so long, and so in efforts to begin the conversation, I, Dr. Ishwaran Kahilithas, will be speaking to the many who have been impacted over the last few years in order to bring back the art of listening so we can all begin to hear as one. Today's guest is Dr. Angela Musso, an international GP who worked for Public Health England during the pandemic and a key worker GP in accident and emergency, working in various specialties and in different countries during the pandemic changed her perspective on healthcare. She has been in the DailyMail for refusing to wear a mask during the pandemic and was denied entry to fly to Canada for similar reasons. Now she is more of a holistic practitioner helping the mind, body and soul. She has made changes within herself and became a better version of herself in efforts to teach others to take back their power and make the world a better place. Dr. Musso and I spoke for 2 hours about her experiences during the last 3 years, meeting people like Matt Hancock, the degradation of Western medicine, and why other health professionals didn't stand up at the start. You can find her contact details in the description below. I hope you enjoy this conversation as much as I did.
So, thank you so much for coming on. I would just love to hear your story and what's been going on in your life, and then we can kind of speak about what we can do in the future, because I think we need to have a deep discussion with regards to what's actually been going on, because I feel it's a deeper problem than what people maybe think it is. So what's been going on in the last 3 years?
It's been tough, I can tell you that. Quite tough. So I was working actually in 2019 in Australia as a GP. I don't know what exactly happened. I decided I need to go back to the UK because I felt that they were it's a bit fake people. Do you understand what I mean? Like, I just see the fakiness, like whatever Trump's talking about with the fake news, fake, like everything was fake. It's all too material, I didn't become a doctor for that. If it was the reason, it's nice to be paid. Don't get me wrong, okay? Because it's an energy. We need to get money and live as well. However, it was like you see people becoming a doctor for different reason, and just sometimes don't care about patients. I've seen all sorts of things, all right? And I just see how much money Australian pharma was making. I must admit, they were prescribing left, right, and center. Oh my goodness, medication. It was just like, Australian doctors are just like pretty bad. Anyway, but at least in the UK was like a nice guidance. You start with one and then the second one, for example, the medication. They just combination of all sorts of things. People were getting sick.
Oh, okay.
Yeah, that's what, that's the one I just realized something is not right. So anyway, I came back to the UK because I'm a UK trained GP. Funny enough, I actually started all my career. I finished my MD in Russia, in Volgograd, but I'm not Russian. I'm Armenian. Okay, so had a few problems there. Sorry, am I going all over the place?
Because that's fine. It's fine.
It's just like how is my career started. So I came here, did the PLAB exam, all of the learn how to speak English. So that was my first challenge, pass English exam or what have you, because I just did my MD in Russia and that was it. So I had to go with the, I did so much like clinical attachment in every single department. It was and I was a single mother at the time. Anyway, so I did that, became a GP. A few things that the GP staff, they don't really like when you tell the truth, and somebody. So I had a few. I will tell in a future. Right now, it's not really that important, that made me so much better person, and I knew the system inside out. What I'm trying to say, and I can see if the things are going wrong. All right. So if it's some manipulation goes on, and when you stand up for yourself and you study, the law, and you tell the truth, it's usually work for you. Do you know what I'm saying? Is the truth is the vibration of the truth. It will come out anyway. Anywhere I went, if it's trouble happen, I will tell them what's going on. They obviously wouldn't believe me, get rid of me, and the things happen. Oh God. So that's what happened. I started working in prison when I came back in 2019. I used to work in prison before. I was a prison GP.
Okay.
I did I did police work, police surgeon. I just like literally know system from inside out. I just knew what's going on.
Mm.
So there was a pharmacist who was prescribing methadone, and they're not allowed to prescribe methadone because there was an incident. I actually report so many incidents. They wouldn't give the medication that the prisoner needed. It was just all by politics. Do you know what I'm saying? I mean, the
Mm-hmm.
treatment, it was so bad. So I obviously complained because it was like, what are you doing? He wouldn't give diazepam. Listen, they're all alcoholic. You know how the
Mm-hmm.
prison work, right? So they all have addictions. They all have very hard lives. I'm not getting anything, but I also see some psychopaths. I see manipulation. I see whole system. It's like all about manipulation, how they anyway, but truth still the truth, you know what I'm saying,
Mm-hmm. Mm-hmm.
wherever it is. So so I've reported, but because I reported, they stopped prescribing methadone, but they got rid of me, which I'm quite grateful because it was too much for me. I couldn't just see it. To be fair, first time when I left the prison, they basically nearly killed my patient just
Mm.
because he was in the bloody. You do understand what I'm saying? They wouldn't call an ambulance because the guy is an alcoholic. You know what I'm saying? It
Mm-hmm.
was so bad. The blood pressure was 70 over 40. I went, so again, alarm, why are you doing this? And I told them, I'm not going to do that. If the medical staff ask him, securities or whatever they are, prison workers, to call ambulance, that's mean call ambulance. So I got a little bit upset over there and I left.
Mm-hmm.
And yeah, I left lots of places, as you can see. If I see something bad happening, I just say things.
Well, that's
So
the thing. So, I mean, for a while,
yeah,
even me, when I when I talk out against the doctors or kind of the service, I'm not. It's not a personal attack. I see it as like a kind of system kind of problem,
yeah,
and healthcare especially. It's like a blame culture, and
mm-hmm.
then um, we kind of brush past the actual problem because we don't want to get sued and we don't want to get blamed. So we actually
Yeah,
blame people, and nothing gets really resolved.
yeah,
And then the person who tells the truth either feels defeated, or feels left out because they're kind of meant to feel left out. So either they kind of go on leading like a double life, seeing kind of these things and being quiet, not really saying much, or you have to leave. It's like one or the other. I think, as we can say, I mean, saying the truth is the kind of most simple thing to do.
mm.
But actually, in the society where telling the lie is more beneficial, it's actually a lot harder. And sometimes I feel crazy. I'm like, something like this is obviously going wrong. This is, and I'm not just talking about the kind of COVID and the pandemic, which you're not actually got to at the moment. But I feel like you're the same. If you see something, you'll say it, and if you can't take it, then you leave, which is a shame because we need more people like you. If there was another 5 doctors in the prison or in a surgery like you could revolutionize the whole system in a week. If you
Yeah,
just told the truth and kind of dealt with kind of things like that, these problems won't kind of persist, and these kind of patients won't come back being more sick, and then the doctors won't be more burnt out later on. But unfortunately, the system doesn't work for people like us. Not saying we're better than other people, just saying it's just a simple
no,
matter of fact of saying something's wrong. I'm highlighting it. Can we sort this out? That's all we're saying that we've done. I mean, that's what I've done anyway, and you've done.
I don't think they're like we're better. I think it's just the scared. It's the fear stopping them to actually see that way.
Yeah.
It's understanding. Lots of people live in denial. Where I am right now, it was a hard road and I had to work on myself. I had lots of traumas. I mean, if I start telling all the story happened in the UK, it's just the top of an iceberg what happened to
Mm.
me since 2019. It's just, that,
Mm-hmm.
but previously it was just all manipulation. I've been victim of that sort of psychopathic, you know.
Yeah, behavior. Yeah, yeah.
previously, when I used to work for, I was a sexual offense examiner as well when I was doing police surgeon. So some realization happened when I was going and doing the when I was accessing my patients, and when we did the training for that, realization happens when you learn and you're open to this, and you kind of have to go through the hard times to realize what exactly happened. It takes some time to deal with all of these things. You're absolutely right where you said, like, they're just hiding, they wouldn't say, the blaming culture. Everybody just should take responsibility.
Yeah.
That's all about.
Yeah.
Literally.
I mean, in your case, I can tell you've worked in loads of different countries. You kind of studied in Russia. You came to England, so you had to learn more than 2 languages. You probably know more than 2 languages, right? You probably know like a handful of languages. You've worked in many different countries, seen many systems. So your lateral thinking skills are there. Like, you've not only dealt with a different range of people and different type of conditions, but you've seen different systems. So what kind of changed, or what was this new journey since the pandemic? Was it a same kind of outgrowth of the previous behavior of healthcare and people and fear? Because most people think it's a new thing, but I think actually the pandemic was going to happen anyway, because I think we were kind of going towards that, the kind of blame culture, kind of reducing all things into one thing, only giving medication, no prevention.
Yeah.
I feel like it was going to go there anyway. And I think if you were lucky enough to be kind of open to kind of see these things, then you will be like, hold on a minute, something's not right. But if you weren't kind of open enough, previous to the pandemic, then you would get kind of lost in it. And it feels like you did the work and you had the journey before the pandemic. Is that right to say?
Yeah, it started probably when my dad passed away, and I lost the back into that. So much happens.
Yeah.
Oh, if we have a time. Are we
We
allowed
have
to?
Yes, you can. Basically, this is just a conversation, because we've not had in the last kind of 5 years any real conversation. So whatever you want to say, it's
It's just, my life is just open. I don't have nothing to. I went through so much. Things happened to me. I mean, as you can imagine, a little bit manipulated quite a bit by ex-part. It was a very good experience, because I've learned how to stand up for myself in a different country without speaking any English. Do you know what I'm saying? I divorced him, so I just don't do with bullying, I guess, because I was bullied in Russia when I was because when you're Armenian, you're kind of different. And I thought because I was Armenian, they were bullying me. But then when I went to Armenia, they bullied me too. So it kind of, you realize you're just different. Do you understand what I'm saying? But I stand up. I'm like, they can't bully me. They try to. So because I had a very good kind of school training in Russia, it's become useful, by the way. Because why am I going there? Because that's what happened when I used to work for Public Health England at Heathrow Airport. So imagine, this is all, you already know what the mask is. First of all, when I started working for Public Health England, it was like this. We went for the training, we were talking about this pandemic or what have you, right? And so my boss telling me, like, N95 mask, this, that, and another, this this doesn't work, So, and the original advice was just then 2 meters, you don't have to wear a mask, or you don't want to scare passengers, blah, 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 all alternative stuff. And then we're now in pandemic, we've seen lots of passengers, some of us getting sick, but I never got sick anyway, so I was very close to anybody. And then I started researching, because 3 months later on, or he started saying us that the same mask he said is not good, it's not going to prevent anything, whoever is telling us to wear that, because Public Health England bosses told us to wear that. Do you understand how much anxiety is causing me, because I know the truth?
So they told you, so before the pandemic, well, near the
And
start
I
of the pandemic, they said it's not, it's kind of useless.
yeah
It's just a
yeah
thing. And
yeah
then halfway through, they were like, you have to wear
yeah.
it. Okay. Yeah.
No, that wasn't even halfway through. It was like it was all started March, April, whatever. He said that, and I'm like, I'm sorry, but you just told me. Oh yes, that was a June time. Remember when they made it 2020? Um, so I wasn't wearing from like end of April already in 2020, because not only it's causing me stuff, and I found out some of the information. I just want to say thank you to Dr. Butar and to David Icke, to be fair. I was just like, it made sense. Do you understand what I'm saying? Because I'm there. One day he's saying this, the second day he's saying this because they told him to say that. I'm like, but you, and they just shut me up. I'm like, oh, I better just stop talking. But I'm just, because when you know, you know. And I mean, so much happened. And at the time while I was working there, I was working in A&E in Norfolk and Norwich Hospital. So I kind of have had a couple of jobs. I was just in, then just did some private work for ADHD because GP wouldn't see patients. It was like,
Oh, the GP sector were extremely scared.
oh, they wouldn't see patients. They all come to A&E. They wouldn't actually see the patients.
It was like, I mean.
And what the gloves and an apron gonna do again?
Yeah,
Iris, please say that to me.
I don't know. It's the same
sorry.
thing. I worked frontline, so I worked because I was a GP trainee. So they asked us to stay behind because of the pandemic. But I was supposed to move on to a new rotation, but they said you have to stay behind because of the pandemic. I was like, fine, I'll stay behind because it's a once in a lifetime. People need help, right?
Exactly.
So it was like you could see China having all these problems. They were slowly moving. Now in my head, I was like, we aren't doing anything to prevent. We can see a virus is moving across the world, but we're not doing anything. We're just waiting for it to hit us. I was like, fine, maybe they know better than me. So then I saw one of the first few patients with clinically diagnosed COVID, because this was before PCR, before all this, came to resus in A&E on a night shift. I was working there. Lungs all white, no smell, all these, and the lady had been traveling. No one was wearing masks because that wasn't a thing that so early. No one was wearing masks. So some of the nurses kind of did that, and I saw the patient, but I was like, it's in the air. I mean, mask or not, now it's in the air. So I just saw the patient, and I was fine. I've not had COVID since. I've never had COVID. Yeah, you've never had it as well. Yeah,
never, literally. It's
yeah.
It's just all how you. It's a lie.
Yeah. I think. Yeah. So we had no masks, right? So, and then, like you said, a few months later, a nurse died in our ward with COVID, or maybe COVID, right? And then after that, we kind of introduced masks and we had national policy. But before that, I was even calling public health England saying, I have a suspected COVID case. What do we do? Because we can't isolate, can't do anything. And they were like, we just kind of treat them as an infectious control case. So they were still spreading in the air. So nurses and doctors and everything, it was already there, kind of introduced. So then from that day on, I realized, okay, I need to protect my family and me. So I did all the research I can, kept up to date with information.
Yeah.
And then doing that, I realized, what are we doing? Like ineffective masking, kind of screening wasn't anything. We weren't looking after our health. They were introducing donuts into kind of the NHS, and I was like,
exactly.
There's a study proving that it will increase the risk by increasing blood sugar levels and all these things. So I felt very kind of alone. Yeah, but it's quite nice knowing that, or kind of comforting knowing that somewhere else in the same country, you were also thinking the same thing, at the same time.
So nice meeting you. It's just, I know. Okay, it's been like, not only you feel alone, you're still going there, and they bully you because you're different. Will try to bully you, but the thing is, I read the law, I read all the legislation, and they're trying to tell me that's not the way it is. Do you know when they fired me from that surgery? There was a conversation with the LMC and that surgery when the guy say, that you need to dictate her to wear mask. The exemption of mask. Remember, I have anxiety, and it's causing when you know. I'm like, come on. Do you understand what I'm
Yes, yeah,
saying?
yeah, 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 yeah.
Talking about that, it's just so. So he said the health it doesn't apply. You know, he says because the COVID 2020 Act, which I used to advise to people, I read. I just don't follow the things. I actually read and advise the correct stuff. So anyway, so do you know that he just said like the COVID, the exemption of mask doesn't work on the health professionals. Do you understand how discriminatory is that? Thank you, Ish. I rest my case, and they're telling me at the courts like, oh yeah, we now have to prove you. It's just like, are you? Anyway, do you know, it's just going forever.
Yeah, but to me, it's just like
Exactly.
Okay, let's say
Exactly.
masks are scientific. Let's say masks are scientific, right? Now, this is the thing. They wanted me to shave my beard because they wanted to fit test me, and this is not like a religious beard. I was like, no, I'm not shaving it
Well
because,
done.
but I was like on my own terms because they ostracized in A&E, and they were like all the time they were kind of singling me out. And the funny thing was, if you had a beard and you had a religious exemption, then it was okay. So I was like,
Mm.
so this mask, which is a scientific thing, like you're
Right?
saying, it works on like it's so ingenious that doctors need it, or like if you have a non-religious kind of beard, then you must shave. But on other occasions, you don't need it. It's like what? Like makes no sense. And as you know, when you go into the staff room, the masks are all down and everyone's having a cup of tea and everyone's talking to each other. So it's like it's not very congruent, and I hate things that aren't congruent. If it doesn't matter, if you're not saying what you're feeling, if you're not doing what the science says in the paper, if you're not acting truly, then this kind of double life, kind of lying to your patients and not lying. I was just like, what is going on? I didn't become a doctor to work in this circus politics. Like I'm not like a politician. This doesn't work with me. So let's rewind. So you're working in A&E and in ADHD clinics and stuff during at the start of the pandemic.
Yeah,
And then what happened?
well, we didn't have any patients. The only patients we had, it was the doctors wouldn't see them, and they got so much worse. Do you understand what I'm saying? They got so much worse. They come in, they haven't had their treatment, their cancer treatment. It was, do you know, I can't like just see. And obviously I start asking and I start seeing patients, and I didn't wear a mask because it did make me feel unwell. So you can't actually see your patients. I'm sorry. It does affect your cognitive. So how can you cannot harm yourself and see patients, because if that causing you harm, you can't make the proper judgment. And it's my oath, do not harm. I'm not harming anybody. Simply I just follow what I know by the legal system ish. Do you know what, when I've heard your story, sorry, I have to mention that you just left and written a book. I'm so thank you for being so brave. Literally, thank you.
It's like, it's weird because it sounds weird. I have to word it properly. I didn't write the book. It was a manifestation of my frustrations and the lives I've seen, and it was all of these things and the truth that I needed to put, and I needed to reset things in myself and show everyone that like I wanted to protect not only science but people. So it for me, the book is not for me. It wasn't like I'm writing the book to become famous or anything like that. I never cared for that thing. It was like it was like I needed to write the book.
Yeah.
You know what I mean? Like it's just like I need to stand up and say stuff.
It's a healing. It's a healing. Do you know what? They did publish about me, because you don't understand. I went to the court. My barrister said to me, "Oh, because it's COVID, you're not gonna win." I'm like, and it was like, "What do you mean? So you think anxiety is not a disability, like for the not wearing mask?" It was like, "No, I didn't say that." I'm like, "So you saying if I have a no leg, and they treat me differently because I have no leg. It's disability, but having this can't wear mask, it's okay. He just went. He said, "It's Angela. It's completely different." You don't understand. Do you understand? That's why the only way to speak out, that was that newspaper who contacted me actually and wanted to hear my story. I'm like, I'll tell you my story. I had enough. Do you understand what I'm saying? It was just like.
So you didn't. So you obviously had an exemption from wearing a mask.
Yeah, because it's
because of
you,
your own
yes,
anxiety.
yes, you don't go to your GP because GP are busy. I already kind of spoke to them. I'm having lots of stress because people are treating me really differently because if you're not wearing mask. Isn't that weird? I'm like, I'm sorry, I can't. Well, I don't understand. Why would you do that? Does it not cause you panic attack?
Angela, when the GP found I wasn't vaccinated, by asking me to tell me all the vaccines I've taken, which was weird because I was working in healthcare, in frontline, in all in pediatrics, in mental health, and no one had asked me. So I had obviously had my vaccine updates, but they wanted the one vaccine, right? And I said no, I didn't take it. The day after I told them, it felt like I had gone in and kind of slapped their mum or something. Like I had so many cold shoulders. They treated me. I was like, what? Like so differently. Like I did something. Like I did a massive crime. And I was like, but I'm the healthiest one here, and I have the most real life knowledge of the condition, and I'm the least scared, and I'm willing to see anyone. They can cough in my face because I know my health is very strong. So because I know I read about my T cells and things like that, and I make sure I maintain that. I also knew the uselessness of the mask was actually means it actually reduces your kind of, like you said, you're not going to be like a very good doctor, and then the jabs increase the risk of COVID. So I was like, no, this is weird, but let me just carry on. So I mean, going back to you, you're working in the front line, you've got all this knowledge, you understand the kind of uselessness of the mask. You're looking, you're going. Someone told at one moment said it's useless. Now they're saying it's right. I don't want to wear it because it's giving me bad mental health and all these things.
She wouldn't understand. It's so much happened in 2020. First of all, I had while I was working, coming from A&E, I had a hit and run accident. Okay, the guy it's just like I've had all of it. If it's not having anxiety, it would be really weird. Do you understand what I'm saying?
Yeah.
It's just like I'm a human. What do you want? If I look after myself and I'm healthy, it doesn't mean you need to treat me differently. You already did that. Anyway, so not only that, I had a hit and run. So my friend actually took me. I managed to recover. So I have another car driving back from Heathrow Airport. When I managed to get back, I'm like, I'm going to do it. 10 days later, I have another accident. Again, the guy come and hit me again. It just threw me off. I just stopped doing for a bit. And A&E wasn't giving me shifts after that because I was speaking, I didn't wear a mask. I didn't have to. I was exempted and all that stuff happened to me. But the problem was there's a nurse over there, which I kind of reported because they give all these drugs without any knowledge.
Where is this? In your GP surgery or in A&E? A&E.
It's GP front door basically, but we're in A&E. We just take patients and just so some nurse practitioners thinking they are really clever. Then some of them are. Don't get me wrong, but then when ego comes, right? They give all these weird drugs which affect the patient, and it is no need for that. And you as a GP taking responsibility. So I actually expressively told them what's going on over there about this nurse, and then they got rid of me, right? I don't have any more shifts. It doesn't coming up. So I have to think. But at the same time, I did voluntary test and trace. You wouldn't believe it. I've got this information from inside out. I'm telling you. Yeah, I'm having
it. Yeah, from every perspective. Yeah.
I went to every single issue. That's what I'm saying. It wasn't just like, I did voluntary, okay? They were paying rubbish. I asked my friends, they wouldn't do it. I'm like, I'll do it. So trained public health while I'm a port doctor. You have only a couple of nights or whatever you're doing, or day shifts. to just advise passengers on all the everyday legality, because they change every day what they do. And it was just like, I was just looking at that and thinking, but whatever they doing is, you have to understand, every stuff they're doing, they seems to be, they wouldn't read everything, because there is an exemption part over there. Yeah, I mean, this is a legality. They are going against their own legal system.
It's a human right issue more than a legality. It's
Whatever. Yes.
You know what I mean? It's a human, and for a medical organization to go against the ethical basis, it was extremely scary to see.
Yeah.
I was like, we should be the gatekeepers of safety in society.
Yeah.
Like, if, shit hits the fan, and it did, lawyers, journalists, and doctors. These three are, respectfully so, in the past, people saw them as kind of well-educated, but also the gatekeepers of information and health and safety. But I was let down by all three, and especially my colleagues, not only the ones I worked with, but I'm talking about like kind of general sense. And even now, I mean, to be fair, we have excess deaths, and it's the fear.
Yeah.
It's the fear. It's the self being scared. But I always say, if 50 doctors at the start were more fearless, we wouldn't have this conversation.
Yeah.
We wouldn't be here. We wouldn't have excess deaths. Only 50, not even 10. 10 really focused and not self-centered, looking for the kind of greater good.
Yeah.
It would have changed overnight, but it just continues to go. It continues to go.
I know, I couldn't understand. So when that problem happened to me, I told these guys you need to stand up and fight, because you're responsible for what's gonna happen to you, because they're still nurse practitioners or prescribers or whatever they are. Because they are just, what they doing, they have a not cheap labor. They're teaching them, they're brainwashing them how to prescribe medication, instead of like, not everybody, don't get me wrong, because there has a lot of empathetic people who actually care about patients, not just do the prescription. But it all depends on the person as well. It all depends how they come to the medicine, as you said, and how ethical they are. Absolutely correctly. Yeah, it's been and talking about ethics, and not only that, sometimes when you see a psychopath, you kind of have the vibe, if you know what I'm talking about. And because I was working for the test and trace, and then after that for London Corona Response Cell, you wouldn't believe it what I've seen. So so we have this, Chris Whitty talking to us, and you can see the way it's so much ego. He just doesn't. And I'm looking at all of this like, Mr. President or Mr. Prime Minister or whatever, health. I saw them, Hancock speaking. He was just an asshole. Am I allowed to say that?
Yeah. I mean, as a person who had a public affair during one of the worst, crisis, I think it's fair to say. I mean, I try to come with compassion and love, but I also do not forget. It's I don't forget. But so let me get this right. You're working in A&E as a GP, and then all this problem happened, and then you say, I'm not wearing it, and then they sack you.
Well, because I'm kind of self-employed, right? And I was getting the shift I wanted, so they basically remove you from shifts. They stop giving to you. That's what they did to me in Public Health England too. They just stopped giving me shifts and removed from.
So that was after. So when you were doing the test, so then you worked there. So what?
I still continue, because Public Health England, they're a little bit clever. Because they know the laws, they just read that exemption part, and they kind of don't bother me. But I've got bothered by other people, like a Heathrow security.
Okay, so you had
like
this.
Yeah.
Sorry, because I want to get your story, because you've had so much going on. A&E, the public health, and then what happened in kind of Heathrow? So
Heathrow is still public health. I was doing kind of process that it was like a step up. I went to RCRs because I was doing the job correctly, and then I've gathered information. I put truthful information in all of the things I've done, because I thought that's the way people can go back and see what happened. Not just following the narrative. I actually did it that way. So it kind of helped from inside because I can see what's going on. I actually challenged one of the consultants, Public Health England, because there was an article came out about ethylene oxide in PCR tests and all this stuff, and he just completely dismissed me and then reported me and what have you. I told him, how does he feel when the children are wearing masks? I say, feel okay for him follow. He is a doctor. So he just said, yeah, he's happy with that. That's what he said to me. Ish, can you imagine? What sort of doctor is that?
Yeah.
Children didn't see another face. They become they start crying if they see somebody's talking without mask. It's a psychological warfare.
Yes, it is. It is psychological warfare. I mean, if the science is, and is shaky, let's say at best shaky. If it's shaky at best, when you concern yourself with the kind of spread of a virus, which is going to spread anyway, I always say, okay, if you're going to wear a mask, it has to be like the best mask possible, and it can only allow oxygen and carbon dioxide to leave and come out, and you have to wear it all the time. You have to wear it in bed and when you're on the toilet, because the virus doesn't just circulate in a section. Even deers in the forest have COVID. So when you walk in the forest, there's a chance you could actually breathe in. So you have to be all or nothing. So that obviously that disproves the use of masks. But then also the kind of evidence out is very shaky. And then you look at the people who want to put it kind of in place. And these people don't care about the welfare of children and all these things. And you go, it doesn't sit right.
Okay.
And you see the power trip. I think some people get a power trip for telling people to wear it. It's like, well, and there's like a visualized, see, because they're wearing a mask, because I have power. So there's like a visual confirmation of they are wearing it.
It's acquiescent. That's what they used to put slaves into the clothes in their mouth. It's a paper done actually in 2021 when they actually mentioned that the psychological effect on mask, and it's a paper, evidence-based medicine, which they should have practiced. Like, it's kind of, I don't understand. Is that evidence-based? That's what we're talking about here, right?
Well, yes. This is the thing I've been reflecting. I don't think we ever have actually followed the evidence base. I don't think we've ever kind of followed real democracy. If you really, really want to get kind of deep into it. And then in your case, people in the last few years, want to talk about mental health and looking after the mental health people. But when push comes to shove, and you say, I have an exemption, they don't see mental health as the kind of same as cancer. Well, they don't see it as the same as a broken leg. They go, well, no. So these things are fake. And the pandemic really kind of brought it out into the open, really brought it out. No one wants to deal with these things. So it's, just put the mask on. It's, and don't say anything. It's like, what? It makes no sense. What happened in Heathrow? So you're working for public health in Heathrow, and then
so I was like a port health doctor. That was a great experience. I mean, I love the people I worked there. Whatever. I just feel sorry because they're brainwashed. But some of them reported me because I just mentioned Chris Whitty's stuff when a P number can go. Isn't that enough to stop the lockdown? Do you know what I'm saying? I was just using their own stuff. I mean, I was telling the truth. So they reported me or whatever they said. Anyway, they're just scared. I forgave. I don't have, because they are really nice people. They're just scared. And so they wouldn't bother me. I even have a picture over there when we all have a picture. We have a team, because we started as a team, like a helping, like we have first COVID response basically at Heathrow Airport. I found it, I still miss them, to be fair. It's just sad. But anyway, so we were all doing this. I was the crazy one because I told them what I think about everything. But because I have a good knowledge, nobody can say anything. I worked in every single department, even by the time. If you,
I just love how you're working as a COVID first response in the first response unit.
I was.
But you yourself, you were like, no, I'm not wearing it, and everyone must have been like, They must have gone home and be like,
They thought I'm crazy.
yeah.
It was funny, but the funny thing is, at the beginning they wouldn't give us masks, and I was like, why would you not give masks to doctors who doing you know, we're key workers. You need to protect us. Do you see the way they are treating people? You need to protect us so we can treat people. I don't understand how difficult to understand that. So they gave this poor GP's apron and N95. How is it going to help against virus? When you told us it's a different, you need to have a fit test and everything if you want to do it properly. How many did have a fit test? You know how expensive was doing a fit test? Even we as a public health officers didn't get, only the bosses got the fit test, not us.
But even, I mean, I would say, so eventually I did shave because I was like, but I only shaved on my terms when I made peace. And then I did the fit test and the fit test didn't even fit. So I really, fit test didn't fit. So I was like, what's like, and also the fit test it's only a test. What would happen? They would do maybe 3 fit tests and 2 would fail and 1 would work. And they'd be like, it works. I was like, yeah, but 2 failed. So it doesn't work. And then also it would move, and the fit test was only subjective perfect, and then they would do it perfect, but it would move, and he would sweat, and he would touch it. And then they also brought in respirators for like a few, maybe 5 months or so, like proper respirators. And the fit test didn't work for me either. And I was just going in because I was just doing I already knew I had the strongest mask, you could say, or respirator, or in the universe, because I had my nasal airway, my white blood cells, an epithelial layer.
Exactly.
This has been evolving for millions of years with many things you cannot even begin to understand. Different hormones react to different hormones, and if you kept this healthy and with repeated kind of exposure on a kind of very on a strong foundation, then actually mask respirators it's actually a joke. It's actually a joke. So I was just putting on. I was like, it's not. I was like, I'm willing to work with no mask, but I mean, they were like, no, don't. And actually, at points, I would take my mask off, because I worked on the COVID ward in kind of A&E, looking and kind of diagnosing whether it's COVID or not. And actually, most of them weren't. They were actually anxiety or maybe PEs and things like that. Yeah. But when they did have COVID, once in a while, I would just take it off and just kind of breathe in the air. I would just take the mask and breathe in the air. I was like, and from this day on, I've been fine.
Yeah, forgive me. Sorry.
Yeah, go on.
No, exactly. You have more problems to wear a mask, because I have patients collapsing because they were wearing in hot weather. So it was perfectly all right trying to get out. Obviously, anxiety, you can see like some sort of, when you look at the patient and you see it's like a quite timid, and you can see something is going on over there. So giving like things are happening, and so she collapsed. That's how bad they are. They come in with all sorts of rashes and what have you.
Yeah.
They COPD, they can't breathe. Yeah. This woman coming and crying and saying, I can't, but it's just like, it's my own experience. What is this all about? And then when you read what in the mask, and anyway, the distance between the fibers is so big. It doesn't do anything.
No, nothing. It's like putting that in your armpit.
Yeah, exactly. Yeah. That genetic material, whatever goes through all this toxin, it so easily go through that through the fibers, because it's like, I don't know how many times is it, 100 times, whatever they were saying, I don't know. So it's just larger. I don't understand. It doesn't make any sense. People just forget about like things make sense.
Yeah, that as well. The kind of reliance on information in journals, but only journals and information that they approve, and not looking at real life data. Because I keep on going, I don't have COVID. My mum, high risk, does not have COVID because I've looked after her with natural things. I don't even like saying natural things, alternative things, just things that human beings have used and should be using for thousands of years, but we've forgotten because now there's a new system in place. Only this vaccine will help. Only this mask will help. And if you don't take it, you're going to be really unwell and be sick. okay, maybe you might be right, but why not also improve sunlight, exercise, make sure they're healthier in other sense, ask them to maybe reduce their smoking. These things could have saved so many more lives, and now we know they would have, and the other things didn't. But this just heavy focus on one key, whilst we know our bodies are so complex that no one key is going to solve anything.
Well, I think apart from being so complex, it's very simple. So simple, literally. And it's all to do with all the toxins that we have and how to remove it. We didn't actually need to have doctors. You have the natural healers and all this stuff easily. It's so easy to treat all of this, because I tell you what exactly happened. So this doctor at Public Health England, he said to me, so if the patient come and for the temperature, would you? I'm like, it's up to him if he want to take paracetamol, but I would try with natural remedies. Do you know what he said to me? And I'm not there to treat symptoms. I actually need to treat the cause. So he said, like, we all have to treat the symptoms, and you should basically leave your license. You should stop being a doctor. That's what he said to me.
You should stop being a doctor?
Yeah, I should stop being a doctor because, I don't want to treat symptoms with paracetamol.
I mean, in a way, that's a compliment now, isn't it? If you look at it, in a way, it's a compliment.
But at the time, he never would speak out. You don't understand, Ish. You can see he was being pulled down for quite some time, and suddenly he has a power. So he comes and attacked the most nicest person over there. I'm not trying, but I was very nice to everybody, okay? Because I do like them, to be fair. Everybody have their own, but you don't come and attack me because I've been saying something you will understand in the future. Do you understand what I'm saying? So I just left. But coming and attacking me is not enough. We can just have discussion. Yeah, it doesn't have to be attack. And you're a man. It's not nice.
So I mean, that's the thing. Maybe if you read my tweets or my messages, you might think, "Wow, he's so fiery and angry." I'm really not. I'm actually really nice, and I spent half an hour with patient because during the pandemic, cancer diagnoses and all these palliative care went down the drain, and so I was spending extra time and effort with mental health. And I would like to say I'm polite, and the people who've met me will say that, and it's up to other people to tell that, right? And I think you just let me know if I'm wrong, but I think we understand that fear is the main problem here, and even in people like Bill Gates and Chris Whitty, it's actually fear of losing power, and it was very deep fear actually in them, and the fear actually makes the self and constructs the thoughts and the ego, and that always wants more and more power, more and more, basically. So now, then you have a situation where I'm actually, I feel sorry and I want to help people, whether it's patients and even if people are being mean to me, I'm like, I don't really care. Like, I know you're scared, and we should really kind of deal with this, and then we can move on and be healthy. And even at a state, I feel sorry for people like Bill Gates and kind of Chris, all these scientists, because they're kind of stuck in this loop, and we are all going towards this kind of suffering. You know what I mean? Not saying I'm getting.
I don't feel sorry for him. I'm sorry, he killed so many patients in Africa.
Yes, no, not in that sense. Obviously, I'm deeply angry, and I condone everything he's done, and I think he should be locked up. But in a deeper sense, there must be underlying trauma or some sort of or kind of inability to look within, because if you want to give people so much pain, there must be deep kind of pain within.
Yeah, usually
right?
pain.
Right.
Yes, it's lots of pain. But sometimes it's like when I worked for the ADHD clinic, it was a psychiatrist there working with me. I've learned quite a few things from her. Like, she was like, have a look at the pain, because we're dealing with the kids, so she would ask if the kids have any empathy at all, and she would tell me like it's a psychopathic trait. It's just kind of things you can see there is no empathy. So some people just don't understand. I think, and I can't actually call them people. It's like there is no soul over there left. It's just,
Yeah, I know what you
they just,
mean.
and it was, what's my point even to prove anything? It's just, it's the lost soul, everybody should take responsibility. Everybody have their own development and wherever they're going. So the main thing I think for all of us to learn to take responsibilities. If everybody would take for their actions, we wouldn't be in this situation.
Yes, because society and life is made up individually. We think it's an external institution or a person or a government or a thing or a mask or a vaccine, but the needing for the other always causes fear and the want, and it causes the destruction of your freedoms, because if the want or the thing has the answer, then you are the slave to that thing.
Yeah.
All the time, whether it's good or bad, you will be the slave to the thing, right? Now, because the world is us, if you look at it in a deeper level, even on a quantum level, in a conscious level, actually, we actually construct the world in our minds, right? Actually, the material and the physical world actually exists in our minds.
Yes.
So actually, the world is us, but the world also has we have like a bi-directional kind of relationship. So the world also feeds into us, and we feed into the world. So we are going about it by wanting to change the world. But actually, the only way to change the world is to change us. It's the only way. Nothing else will change. If we don't understand this is like, I think, the fundamentals of understanding, then we'll have another pandemic in maybe 10 years' time. We'll have the same thing again, and people will be going, oh my God, more people are dying. And no one will actually care. Because I think, like you said, responsibility is within you. And so this is why I left. This is why I wrote the book. This is why I do the podcast, because I want this to be in the world. I work out. I go, I look after myself because I want the world to also be healthy. So if I was not doing that, then the world won't be like that. In a simple sense, if I'm not loving and kind or want justice, then how can I expect the world to be? It doesn't work like that. Then I'm asking again. So only I can change. Only I can cultivate this peace and have a light. And like you said, there's people out there who can't feel it, and maybe they have psychopathic tendencies. I don't know, but maybe I have hope that there is something deeper that we can connect. There's, the essence of human in them. There is still there. Maybe that's just me hoping. I don't know. But I think I had a lot of anger, and I still do. But now, for me, it's like I'm just going to shine. I think that's the only way. And I think we need to we have to connect. Me and you and other people, just to bring this out now.
Yes, exactly. It's been like they've been like not only with the mask, but with all of this, remove from here, remove from there. She doesn't need to talk. It's just like removing. You don't, and the way. So because I have all these court cases, it's quite a lot. We will. I don't know. We don't have time proper to talk about it.
No, we have time. I mean, the last one was 3 hours, so we have time.
Oh, so cool. So well, basically, what happened? The only kind of I'm just doing the right thing to deal with my trauma, because trauma was massive. Okay, coming back to, I felt bullied like I was at school because I was different, just because I was Armenian or whatever they created at the time. But then you realize it's just a simple jealousy, because I don't know, I was the kind of a best in the school, if you know what I'm saying. And a nice one, and the people use that, because that's another thing you need to deal with. There's a victimhood, which I cannot. I could have just become a victim and then la 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 and complain all the time, and it's just it's boring. So but then, because you're empath, you can just follow through that, because you can be just stuck with the victim too. And that's the difficult part, because you kind of feel you're doing something, you're helping, but at the same time you're actually harming them by allowing them to treat you that way. So the first thing is love yourself. And I think with these 3 years I've actually learned to do that. And my first experience when I realized that was all happening, when I had the ayahuasca experience.
Oh God. Okay, tell me.
Honestly, oh, that was a spiritual awakening, I tell you. So I was studying about the food, what they put in, all the poisonous
Mm-hmm.
stuff they put in, water things,
Mm-hmm.
and like, it was just panicky quite a bit, thinking, oh my gosh, and this, and then creams, and then I start
Mm-hmm.
producing my own cream.
Mm-hmm.
Then I start producing my own stuff. I take, natural, to basically what I would like to show, like you do. It's amazing. Thank you for doing this. It's just on my own, like, example, to show what you can achieve.
Mm-hmm.
Because I do exercise. When I left, I actually tried to do some modeling, and they accepted me. Do you know what I'm
Mm-hmm.
saying? Things are happening. So even though it's lots of bad things, not bad things, it's traumatic things where I have to, living through that and go through that darkness. It's like, within three years I lived like 10 lifetimes or
Mm-hmm.
something.
Mm-hmm. Mm-hmm. Yes, I understand. 100%. And I don't know, do you feel like your past life is like a dream now? It doesn't feel this.
Yeah.
There's no. You know it existed, but in a way you
Yeah.
kind of don't know it because you're now a new person.
Yes, because things are changing, and you're changing it's like, it's so interesting. I feel like I'm in a movie right now, to be fair. I'm just observing, but things happen, obviously. The healing process, that because at the ayahuasca I went to spiritual world, actually.
Mm-hmm.
I went, it was lots of healing, but I went to, and I saw my past life, and it was so interesting. Do you know what I'm saying? And then the first day was, it showed me that I need to kind of love. It was,
Mm-hmm.
and with lots of Persian happening. It's um then when I realized, was like, in my head it comes same as when I saw military action. I saw some worms in the bloodstreams, or whatever, the parasites, which is not from this universe, by the way. um so I came home and made a treatment for the parasites using some Russian sacred recipe, and which one I'm using right now, because we're full of it. Basically, if you start studying, that's the things they wouldn't give us in the medical school. You see, is we kind of study things, but don't, it's no connection there, right? That's why they're doing like these specialties, and even smaller specialties, so people don't understand other specialties. Because I work in every specialty, if you want, if you know what
Yeah,
I'm saying.
yeah, yeah,
They're literally different things between
yeah.
each other.
This
Like,
this is the thing. I mean, I worked in Cambodia as well, as a
wow.
doctor for like six
Yeah.
months on a boat,
Mhm.
and it opened my mind because I was like, hold on a minute, these people. The one thing that really opened my mind was these men in their 60s had six packs and was lean, and I was like, but they don't have a gym membership. They some of the poorest people, but they're fit. I mean, they had
Yeah.
other conditions, but they were fit, and I was like, oh, we are being lied to in the West. We are being there's a veil of like, this is an amazing place and everyone's so beautiful, and look, you can buy your Ferrari. But I saw children play with bottles and they were happy, and I saw people with no money who give me food, and I was like, I felt real kind of the real kind of deep kind of essence of man, and kind of in that kind of place. And I came back to England, and that shifted me. And I felt really
Mm,
low actually for a while when I came back,
mm.
because I went back to the healthcare system,
Yeah.
and I was already doing work and understanding food and diet and all these things. And the problem is, people might say it was Rockefeller or anyone who introduced petroleum-based medicines into the healthcare literature and stopped a load of things and rewrote the healthcare practices.
Yeah.
But that the healthcare model is a cause and effect model. So that's the one problem. Number two, it is a reductionist model. So we go for the smaller things, smaller things, smaller things. So we become sub kind of specialize and more, and we do that even more and more. But we can't generalize. So,
Yeah.
but actually, maybe because the brain is unable to experience the kind of infinite. Our brain is unable to really grasp the totality of health and the world. And we don't understand actually the world is us and us, we are the world. We think health is only us, and we think it's the small thing, and we think it's cause and effects. Everything's one or the other. But actually, health is a whole interconnected web of everything. And your immune system affects the way you deposit fat. Your catecholamines affect whether you die after your vaccine. Random. Why? Why? But everything works in a kind of beautiful way. And also, what's in your water affects your health. What's in the air can increase your risk of infection. All these things. So that's a web. But that doesn't. Sorry.
The negative thought, which is the main thing, which increase all of that stuff too, because there are toxins too, like you said, or air, water, negative thoughts.
Negative thought, 100%. Yeah.
Fear.
Fear, 100%. And I think even we can go to the point where fear and excessive thoughts can actually cause physiological harm, and actually harms even beyond some things we even know. And if actually you reduce these things, you could be exponentially much more kind of healthier. You can even live longer. Now this is for others who are still in the medical model of thinking. They might think I'm woo or crazy, but I have evidence and base, and I don't really mind, because I'm trying to shift healthcare differently.
Ish, I think you're amazing, and I have the same things. And because the negative thoughts, they create their own reality, so they actually create the reality of having a problem. Do you know when the patients come and say, "Oh, I have a pain here," you do lots of investigation. They keep coming, and then suddenly they have that, and doctors miss that. You've heard all these stories in NHS, right? This is all to do with all of this. And the main things, it's here. Like, we don't even treat that. We don't look at the patients. It's all psychological. It's all traumas. It's all trauma based.
And that's the problem. I think this reductionist model needs to stop now. And this reductionist model, it's bad because it's divisive, because it's fragmentary. So you have all these things, and between the fragments, you will always have division. So there will always be conflict. I know I'm cardiologist, said it won't work with the brain. Oh, then you realize there's a mind-heart connection, and there's a gut-brain connection, and even that is ruptures. It's even this. They're so complex. So I think the pandemic just was an outgrowth of that, because it was like one vaccine for your kind of immune system, which is so complex. It's kind of beyond measure. But this one thing so simple can cure it. Obviously not. And the doctors are stuck in here, whether intentionally or not. And some still kind of genuinely do think and did believe that these things would have helped. But if you, like you, understand the deeper complexities of health and the world, then you go, actually, no, it's not going to help, because there's other things. Words are complex.
About vaccine, actually, I just want to mention, because it's kind of important. What happened? As you know, I've been vaccinated up to bottom, brainwashed and whatever. Same. I just telling the truth. What happened in Australia when I had some problems, gynecological issues? So I actually had the HPV vaccine, because one of my UK doctor colleagues said, "You should have it." And I just went, okay then. So I had an injury, it's actually affected me. However, none of them would accept that was it. And then when in 2020, I started looking into what HPV vaccine can do. I've inflicted basically myself by trusting, UK graduate GP thought, So that's just, believing just the one thing, and it's going to prevent you, but actually causing things. So yes, it's been.
That's the thing. When you don't understand the system, you will cause havoc. Like I say, if you bring a spanner and there's like a running car engine, it's so complex, right? And if you take the spanner and you chuck the spanner in, maybe 1 in 100 will be fine. It will be okay. Maybe actually 1 in a million, it'll make the car go better. But actually, most of the cases, the spanner would cause problems that you don't even know. And I think I use a theory when it comes to these shots. I mean, I don't even call it kind of vaccines anymore, because they're not. So we don't know the implications.
But they say that on a thing is written experimental. The thing is, they actually write, they tell the truth. We just don't look at it. It says experimental vaccine. I mean, how truthful you're gonna be out of that? Do you understand what I'm saying?
I mean, they do it because
They-
they can get away with it afterwards, can't they?
yeah, that's the whole thing. It's a proper mind like blowing, like what they're doing. It's actually written there, and you can see like lots of vaccine injured people like now calling them say, well, yeah, it's but it's experimental. Yeah, we didn't do anything on the mice. So like they're telling, and this woman crying, right? And they were just almost like, like you should have read, or why did you do it? It's you guys who pushed me to do it. Do you understand
Yeah,
what's going on?
it's actually sickening. It's actually, I mean, coming from a family who fled a genocide and also working in a country that experienced it, a lot of the tactics I saw in the last kind of 3 years was very, very similar to what I've read and had heard about in this kind of genocidal tactics, kind of communistic. If I mean, I know that's a word, but these tactics, and I was like, it just doesn't sit right. I was lucky to have a past with trauma because it was like, hold on a minute, I had a distrust anyway when it comes to kind of authority. So I think that helped me. Now, you
good.
That's
good.
Did you get? Is this right in me saying that you got kicked off a plane, and then what? And then what about Canada? So if you can go in both.
So while I was working in A&E, the Canada was happening even before that, but because of the lockdown, it was taken. Like, I've been offered a job. I've accepted it in June 2020, but it's all to do with me sorting out the paperwork, what have you. And when a contract I signed, there was no mention about vaccines. So, signing before that. So, oh my goodness.
So was that job in Canada?
Yeah, job in Canada.
Okay. Yeah.
Nova Scotia. So you wouldn't understand that the woman was just written to me. Anyway, so the job in Canada, but however, so we organizing, everything goes. I had so much things happening. So finally I decided to go we're in 2022. I'm sorting out January, February, sorting out how to get there, go there for 1 year to work. Obviously, because there was exemption of medical practitioners, they don't have to have a vaccine, and I have exemption for mask wearing, and so they wouldn't let me in. They actually went without me. I came to board, and they said, we can't accept you.
Hold on, wait, you got to Canada?
No, I went to the plane, and they said, we can't accept you. Yes, we can't accept you. It's a Canadian Airlines.
Right.
No, you don't, because you don't wear a mask. And they just left me over there. I'm like, but I have everything signed by law, No, it doesn't have to be. Basically the GP has to be from Canada or something that needs to send it. So I have 3 GPs actually signed. No, 1 GP in Canada. He's my friend. We used to work in prison way back, like 10 years ago. So he basically signed that stuff for us to go the next day. They got whole security. You don't understand, to the point that I tell my son to call police, because they actually is like a 5-6 of them guys. They just saying about the mask. I'm like, I have exemption, and you ask me to do it after. You don't understand. I have this on video. The things I've been through is just like, you're gonna be like, wow. So, and they said to me, okay, go to stay in a hotel. The next day I come. That's when I called the police and said they're attacking us. My son called the police, and then he said, because I stood up for myself, the tall guy security said, I'm scared of you. I can't talk to him. I'm like, you not allow me to go. I've done what you said me to do. You said the other people, it's already been discussed. You don't understand. They say one thing and they change the other things, and it's all lie, because I followed every single rule. Anyway, so they said, well, we'll give you open tickets for 3 months, the Canadian Air. And I just, whatever, I don't remember what exactly happened. It was so many things going on, and I had a hearing as well for the employment tribunal at the same time. So I came back home, and later on in July, because it was in March, beginning of March, later on that year, like in July or June, they've sent me an email when I said, you know what, I can decide to come or what have you. So they sent me an email saying that they withdraw their offer because I'm not vaccinated.
Okay. No, okay, there's a lot to pick in here. Okay, go on, carry on. There's more.
Not only that, no, you're not vaccinated. Mind you, that time I already have court going on with the Cutler Hill surgery, the people who fired me. And obviously I went and just done with the Heathrow airport because they're the worst one. They're like Nazi, honestly. The way, and it's a man over there. You know, when I said I felt like I'm at school, because at school I've been attacked by lots of, because they were scared to touch me by myself, I guess. So I felt that, you know, I was feeling panicky. I'm like, am I going back to school again? What the hell is going on? You are grown-up people. How can you be like this?
100%. You see the child in them. You see like a child, and then you also see an emptiness, and you see it's like they've been zombified.
Yeah.
So whatever you do or say, it doesn't matter. You could have jumped off the building and they wouldn't have cared. It's like their mind is just
completely
has it taken over. So
yeah,
I mean, I respect you wholeheartedly because it takes. I'm screaming and shouting. It's not only important to be someone who's clever or kind of intelligent, but you have to have no fear, because only when you have no fear can you truly be truly be clever and work in an intelligent way, right? And the fact that because that's such an awkward, extremely difficult position to be, kind of nearly going onto a plane, so no one's warned you at all, so you don't even know. So you're thinking you're going to go on a plane and have a nice trip to Canada. You're with your son. Everyone else is on the plane waiting, and then there's this thing going on, and you're thinking, okay, if I wear the mask, I can go to Canada. But why did you choose not to? What was like the thing that said, no, I'm not wearing this?
But it's causing harm to my. It caused anxiety.
Anxiety. Yeah. Okay.
Why would I even wear that stuff?
Yeah.
It's just against everything. Why do I have to? I'm sorry. Like,
yeah.
I don't understand I saw a 5-year-old, they put the mask on. I saw it's a humans, just wake up.
Yeah.
They hung. The thing is prior to that, they called Canadian border. They talked to me. I told them what's happened. I have this and that. This woman was helpful. So when I went there, they said, well, you need to sign on our piece of paper, basically. So that's why they organized for me hotel that night. So I already have signed on their piece of paper, because, you know, people are helping me, what have you, in Canada. That was a Canadian physician, and, you know, so I'm bringing that to them. I've sent it. They still wouldn't let me go.
So it's more than the science, like we know now. Because if everyone else is wearing it, then what's the problem?
If you think about legally, it's coercion, because it's a medical treatment. I am a doctor as well. I know what's going on, but some stuff doesn't have any medical knowledge. Coercing other to wear, it's a coercion. It's impersonating a doctor. It's a criminal offense.
100%.
People don't know the law.
No, it's 100% criminal offense. It's actually inhumane. The fact you're forcing a medical procedure or anything, you know, I would even go, and people might call me kind of extreme, it's a form of rape, because you're putting your ideologies or your reality, and you're forcing it on someone, and you're restricting their movement and their livelihood. You know, that's a form of whatever you call it, as a kind of psychological rape. And it's actually disgusting, actually, the way that people have treated other people in the last few years. And the fact that if you would take the mask, they would have just carried on with their lives. Like, you wearing a mask or not, it doesn't affect them whatsoever, but they want the power trip.
Yes, I'm not acquiescing as well. And plus, I know what you're doing, and it's causing me anxiety, because I know exactly what's happening, and it's illegal. Not only I know what's happening, it's by the law.
It's illegal.
I don't understand. Why don't you just read that? You can't give me this advice?
Yeah,
Did you,
100%.
like
Like,
a
yeah,
security guy in an airport gonna give me what I'm wearing or not?
it's like asking someone who has a disability who can't walk, saying you have to use the stairs,
Yeah, pretty much.
isn't it?
Pretty much.
It's like saying no,
Yes.
no. It's like no, you have to. Oh, you can't.
Can't
No,
do it.
you can't do it. Then you can't get a calendar.
Yeah. That was pretty much what exactly happened. And kind of people don't understand. And I'm sitting here thinking, but you're speaking to, I would probably know what's causing me anxiety or not. Everyone would know. And not only like I read, so I have some sort of intelligence being a doctor. Do you understand what I'm saying? And kind of no, that's what they did in 1939 or whatever, with then started with Nazi Germany. By the way, I coming from a Holocaust family because Armenian been,
I
has
know. Yeah.
so much stuff is like I've seen it inside out like you did. That's why you were asking questions, Ish.
Mm.
It's good that you have that experience on the history, because same as what happened with Russians. Like when you living in a communist, I remember when I was a child, I can see that whatever they say on TV is not actually what it is.
You
And I
get
was
it. Yeah.
thinking people believe this stuff. It's like completely brainwashed. You realizing what's going on sometimes, but it's just
I understand, or I can actually empathize with you because I mean, to an extent, because during the second part of the pandemic, and I did all the research, and I was like, I'm not wearing a mask in public because it caused me anxiety to wear it because I knew all these things. So when I wore it, I was like, I was going against myself, and I felt a sense of panic and like I let myself down, like very, very deeply. And then I also knew it was incongruent again. It was I can't be a kind of someone who says something and does something else. It's not in me. So I was like, I don't care. I'm not wearing one. Wherever I went, so I went to shopping centers, and people will ask me to wear them. Like, no, I'm not wearing one, and they just say fine. If you say in a nice way, so I'm not wearing one, and then eventually I'll say I have I've got like a medical kind of thing, and I can't wear it. Eventually I say that, but at the start I say I'm not doing it.
But you do have a medical, because in a COVID-20, I've just mentioned that because people don't, it says if you exempt if that causing you any sort of distress.
Yes. What?
That is already exempt, so it's causing you distress.
Yeah,
And
100%.
it's causing everybody distress, so I don't know why they're still wearing, to be fair. But
I
it
don't
is
know.
me and my son went to this, well, it was pretty bad here in a mall. They had the officer with the mask. Do you know what they give to us? The gold yellow star. That's what they used to give Jews. Literally, that's what I've been given. And you're like, and I'm like, I don't care. I just put that, like, yeah. Look, the Ish, can you? It's like I was like
No.
living in a movie.
Yeah, I mean that's
People know what they're doing.
yeah. No, it was ridiculous. It was crazy because I didn't bring up the medical thing when I spoke because I didn't want that to be like paperwork. Like, oh, okay, medical, fine, then you're exempt. I was like, no, I'm a human. I don't want to wear one. You want to wear one? You wear one.
Yeah.
I'm not asking you to. So that was my thing. I'm in a free country. I was born free. I would die free. So
Yeah.
I went to a shop and I walked in, and the panic in their eyes. They were like, no, you have to wear a mask if you want to come in. I was like, I don't have to wear a mask if I want to come in. Very, very nicely. And I was with my girlfriend, and we're not very confrontational. I'm not very confrontational, but if I see wrongdoing, I'm going to say something. Okay.
Yes.
If I see something happening, I'm going to say something. If it's something happening to someone, I'm going to step in. But they will say, no, you can't. And I was like, I read the law and I read everything. So I was like, no, I don't have to wear one. And I was like, if you want, you can call your manager. And then they did, and when we spoke, and they said, no, you're not allowed to come in. I said, have you read the law? Like, what you're doing is actually criminal. And they were like, no, it's not. I was like, I highly advise you read the actual guidance. And then I said, I have a medical thing, right? And then they were like, I don't think you do. And I was like, wow.
My God.
And I was like, wow.
They're not doctors. They can't actually judge you in any sort of way,
So at that moment, I didn't want to be in the shop anymore. I was like, okay. I said, be careful how you're treating other customers, because I had enough stress in my life at the moment. I was leaving work and all these things, so I was like, be careful how you're treating others, because what you're doing is actually criminal.
Yeah.
But at that moment, I realized in their eyes the kind of flash of, wow, this is how things in the past must have happened. You know, all these bad things, we go now, oh my god, I can't believe this happened, and we have remembrance days and massive museums kind of dedicated, and everyone, you know, yes, that's all well and good, but are we actually learning? I don't think we were, because I don't think we are, because when things like this happened, people switched.
Yeah.
So I was really taken back. I was like, wow, because as you know, as you worked in many different fields, you understand very deeply, more than the average person, what's going on, your health, mask, and everything. And then when someone tells you, pretty much kind of gaslighting to the highest level,
Yes.
literally changing your reality, I think, am I going crazy? It's like I'm in a different world.
What? Yes. It is. It's like, I can't believe this.
It's ridiculous. So what's going on with you now?
Well, well, so much happened. So my last day at work was on 31st when I went to the surgery, and they treat locum doctors bad. And every single surgery, like, I took to the employment tribunal, because that's the second surgery I took it to employment tribunal. People came and told me that they had problems with their this big corporation, when they treat humans so bad, and because people let them get away because it's too much. And I just didn't know. I needed to write something, even if it's not going anywhere, if you know what I'm saying. And you wouldn't believe it. And then they lawyer said, I'm not allowed to use employment tribunal because I'm a locum doctor, and locum doctor don't have rights. Mind you, I already have a court case hearing going on against that. And I'm just sitting down there thinking, is these people stupid? So you know how they're turning around. You haven't been employed but that surgery for 2 years. Oh, hold on. But I have been employed to do GP work for NHS for more than 10 years. So you know what? It's actually between you two. You need to treat people correctly. Do you know that's why locum doctors having all sorts of things, can't get money, can't get this. I'm not saying anything. Some locum doctors are pretty, but if you know what I'm saying, and some regular doctors can be like, wow, it's like, how long it's been going on. I mean, that's why I leave a lot of surgeries, because it's just a drug prescribing, and they're all reacting between each other, and you're like, I'm just surprised this patient is not dead. Do you know what I'm saying?
No, my God, 100% yeah. It's like, with all those chemicals, how are you functioning?
I know, like, at least, and it's just like, wow. I mean, that shows how strong we are, if you think about it.
100%, yeah. We're so resilient, but the resilience has allowed the suffering to continue.
Yeah. Honestly, it's been going on so much. Yes, so I right now, obviously, I couldn't. The what is threw me off. It's personal, but I've been kind of attacked by police.
Okay.
For the false accusation. So in my own house, Norfolk police gonna go in it. Like, they came and arrested my youngest son, thinking that my oldest one, but because my oldest one was having some issues with ex-partner, like whatever they do, and it's not the stuff, but the whole thing, they come into my house and arrested my 14-year-old at the time. Because 14-year-old says, like, who are you? Why are you coming in my house? I don't give you implied right to come into my property. I mean, they kind of said sorry, but they still lied on their report. They said sorry. I've reported as a complaint. Like, you can't just come and just do this stuff. You need to understand. You need to, first of all, realize if that's the person. Secondly, it was alleged. Alleged. You investigate. So I've seen police from that, and I'm like, I mean, I work for the police, and I know some of them good, some of them pretty bad. It was the ego trip, because I've seen it. I've seen the way they will start treating me, and I left as well. It's everywhere, bad and good people in every. But at that time, they're gone a little bit crazy how they're using their power. It's just like.
Oh yeah. That's the thing I realized as well. Like around the pandemic, we gave people who weren't used to power, and they were really tripping on power. There was
Yes.
so I was working in kind of A&E during the pandemic, and my nan was unwell. So my grandma was very unwell. She was taken to hospital and she had sepsis. So I had to ask my consultants to go and see her. So I was one of the doctors there, and I used to work on that ward that my nan was in. But even then, when I went to see her, the nurses were like, "Oh, like like why you here?" kind of energy. And I was like, "That's my nan, and I'm a doctor here, so I think I have a right to come here." Anyway, anyway, she deteriorated and she was dying. So it was let's say 1 a.m. I get a phone call from the doctors saying, "Oh, your nan's we're gonna put her. You're gonna make sure she's comfortable." So I knew what that meant. So I called all the.
Midazolam.
Sorry.
Was that meant to be on midazolam?
No, not down that route. It's just like we just taken her off the meds. I think she's approaching that, and then so I was like, "Can I go and visit her?" And it was like, "Yeah, it's fine." So this time the COVID policy in hospital was like you can't really visit and stuff, but it was unsure, and the doctor said we can, because we had spoken to the nurses on the ward beforehand, and a few days before, like me and my family, we went, and they said if that comes to the thing, you can actually go and see her. So we were like, fine, we can go and see. So I called my family and we go individually just to go and see my nan, very respectfully. And then midway through, one of the matrons there, who I used to work with, she was like, "What are you doing here?" I was like, "My nan is dying, and we're showing our respects for the last time, and then after this, we won't be here again, and she will be gone. This is what we're doing." She was like, I'm going to call security on you and your family." I used to work with her on that ward, and I was like, I told her, "Why did you become a nurse?"
Wow, Ish, I'm so sorry.
That's okay.
You feel that from inside, and like you have saying goodbye to you. She just destroyed that by calling security. Yeah.
So I said, like, where is the compassion? Like, why did you become a nurse? And she was like, "Oh, it doesn't matter. I'm going to call security." I was like, "Call security. I don't care." And I managed to get everyone else to say their goodbyes. And later, as we left hospital, you could see her, the nurse, on the top floor, just looking down on us, like these people coming in and stuff. And it's like, where did the compassion go in the last 2 years? In the last kind of 3 years?
I don't know. I don't understand it. I couldn't understand it, to be fair. Like, why did you become? It's like they wouldn't go see. I think they were a little bit angry. I went and do the home visit, seeing the face to face, because you don't know what's happening. Mental health illness. Like, I don't know what's gonna happen if this telephone consultation. I was like, I'm going to see patients because I couldn't get hold of her. Do you know, I had some on and off places. They were kind of okay for me not wear a mask, because more understandable than this practice. But they wouldn't ask me, but obviously because I kind of give some sort of different view to the public. So I guess that was it, and they were a bit scared.
Is it more like is it a group mentality? Because let's say mask and vaccines work, okay, but you don't want to wear one. If they wear one, then they're protected, right?
Yeah.
Let's say. So what's the deal? Like, I always ask them, why do you want me to get it when you have the thing that protects you? Okay, in these meetings, I'm like, can someone give me? I would say evidence, medical. Like, I would say we're all doctors here, right? So we do science. Can someone give me a journal, medical evidence, or even common sense why you want me to take the thing that you've taken already to protect yourself?
Right.
And they said, eventually, it's just politics, politics.
I'm going to kill yourself for politics and killing others. I'm sorry. Why would I do?
That's the thing. And I said I didn't become a politician. And I knew then, I was like, this is not for me. This is not for me. But this is the thing with you, right? Even in the practices that you were allowed and we weren't allowed, it wasn't about the mask. It was the fact that you weren't in the group. It was like a school, like, oh my God, she's not in the group. Oh, she's weird. I don't like her. It's like, what? How old are you? Like,
Yeah,
come on.
it's like
You have children, like, and you were supposed to look after people. Like, it's ridiculous, really.
all because of the blaming culture and about complaints. Yappy, 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 yappy. I'm sorry. Even like a group of doctors where it's just like complain. I don't do that. It's my positive vibration. I create my own reality. I study what I'm going to use in my own life, and with my own example, I'll show people how to get your power back. I'm a single mother. I'm a woman, because women come and complain. My husband, I'm like, oh God, just do something. Yes, complaining to me, I don't know what's. It's good when you got your trauma, but you need to stand up, and it's actions which is more important for me, not just this blah blah blah. I live for the doctors doing all the statistics and what have you, because I already learned what I have to do.
Yeah. I think there's 2 points there. I think one, it comes back to self-responsibility. Like, you have to be responsible for eventually you learn your trauma is actually you. It might be inflicted on you, but it's your perspective on it that caused it. And it could be extremely bad, and that's a difficult thing to say, and people might not like it, but I've gone through difficult stuff. I've had a lot of issues in my past, but you make a switch and you go, it's not going to change until I change. So that's the thing. And then after that, this victimization, you don't really want it, and you don't really want to be around it. You see why people do it, and you're kind of compassionate about it, but eventually you think people are just going in circles. And the other thing I want to bring up is you are really recently more and more realizing, especially after the kind of fall of the experts, and also how nearly all medical information is actually biased and doesn't really make sense, and all can be bought. You realize that the heavy emphasis on information and also knowledge is actually disastrous if we overdo it. And actually there's an underlying intuition or a feeling that is more important, or kind of real life evidence. Like I would say, I worked in pediatrics, and during the second wave, I saw one kid with COVID who had a very high BMI, but they were fine afterwards. On Twitter, everyone was like, children need vaccines because they're dying, and this paper says this. I was like, that doesn't make sense, because I'm working in a pediatric center, and actually there's no patient. It was empty. So I was like, we're going to see more bronchiolitis next year, but COVID, they're fine because they have good T cells and other things. But so actually the reliance on the expert or the information is causing harm.
Yes.
And
correct.
Moving away from real life data, moving away from this gut feeling has actually been kind of played down maybe by this kind of Western narrative over time. But that was actually used more, like in the past. Maybe your grandmothers would use it, like, I don't feel something right, and then later on they'll be 100% correct. Their intuition was so good, right?
Yeah. Yes.
But now we've kind of weakened it.
Yeah, because of all these studies and this amount, and they don't actually disclose all the information, because I used to have so many drug rep coming in Australia telling how good this drug is, and they've done one study for the like 1 or 2 months, and I just really, anyway, well, so however, it's just, and they make it so complicated, it just doesn't make sense. But it doesn't make sense for reason to make you, but when you start reading it and you look in, it's completely different information actually written there. They tell the truth, but they're deceptive what they tell
100%.
Yeah. So I'm kind of like it, to be fair, because the surgeons or ever been trained by in my career as because I work like as a house officer and senior house, I have like, or even in GP, lots of doctors would say like, go with your gut feeling, what you feel, because we did have a like, and some doctors say, well, don't give them meds, to try, actually we had okay doctors, if you think about it, right? I don't know what's happened afterwards, just they all gone into vaccine and what have you, but they did. I remember when I was training, even in GP like VCS, they would say like, what's your feeling about it, you kind of, helping it. Even in the negative stuff, we can always find positive. They will tell the truth. It's that no one will look at that, or maybe you won't have the advice to get, or maybe your head is somewhere else to just become a GP and have a nice car, whatever house. It never. I don't really care. You know what I'm saying? I choose to be happy. That's the most important thing. And that's another thing. I think the way you're looking at the problems, you either be sad and be victim, or just be happy and change your life.
Yeah, it's perspective, isn't it? At the end of the day, and I think going back to the gut instincts and seeing the patient for something more deeper, that's where you get the real answers. You know, when they walk in and there's like a twitch in their eye or the muscles in their faces, but they say something else, and you go,
Yeah,
something doesn't sit right. It's something else going on. And then they eventually say, yeah, I'm scared of this thing, or I know I have pain in my jaw, really, not in my ear. And then you diagnose something else, or I've lost weight. You know, then that's when you kind of go with. Then you will find the real kind of root cause. But the thing now is, GPs are been turned into robots or kind of factory machines, because we look at nice guidelines, right? Which is a detriment for the healthcare system, because actually in a few years as a kind of artificial intelligence will take over, because what doctors are doing are an algorithm in their brain, and a computer can do it, and the computer won't be racist, it won't be biased, it won't be tired, and be much faster, and patients will be like, that's perfect. So actually doctors need to move, and they have to start thinking, what can I bring that a machine can't?
Not about thinking. I will give you another example about the guidance, and you understand they are going even against the. It's like I used to, but literally that's the way I was actually talking with NHS England, but in a nicer way. So ADHD clinic, right? We're having this woman because I wouldn't prescribe methylphenidate for the first, because it's bad for kids. I probably wouldn't prescribe the other bits, but I only prescribe atomoxetine in that clinic. Psychiatrists there, whatever. So they come in as a psychotherapist or psychologist to make a diagnosis. Looks like a ADHD or whatever. So this woman asking for methylphenidate, I'm like, we don't prescribe that here, and even the whatever even that prescription is not good for you, because you had a bleed in the past. Look what happened afterwards. So not only you kind of followed the nice guidance, you're actually saving her life, right? So she goes to complain about me to GMC, which goes to NHS England. NHS England's going on and on and on investigating. I'm like, I don't understand, what's the problem? I saved this woman's life. I wouldn't prescribe her methylphenidate. I gave her, nicer antidepressant that helps with ADHD. In fact, I don't actually like to prescribe it. And they couldn't understand that wasn't me who was making a diagnosis. We have a psychiatrist and, psychologist. I'm there for the physical health and be given. So it lasted for, I don't know, 3 to 6 months. I'm like, refer me wherever you want to refer me. So they referred me. They said, oh, okay. So, and then responsible officer called, and I'm like, do you understand? It's a absolute contraindication to give people like this methylphenidate. Do you understand what's going on? But nice guidance say yes, but also
it's this hive mind. It's this zombie mind, isn't it? It's the same zombie mind that says put the mask on because there's guidance. It's like, you have the most amazingly intricate, complex machine in the universe, and you fail to use it or to appreciate it even.
Yeah, exactly. Not only that, you basically telling me to prescribe this thing because nice guidance tell me so I can kill the patient.
Yeah, then why ask me to do it? Ask a robot to come and do it then. Like, why am I the doctor here then?
Well, that's what they're doing it, isn't it? They're planning this robot. They started with not face-to-face, so there is no connection between patient and exactly feeling. Do you know when that guy was, when he was firing me because I wouldn't wear a mask, I told him what's happening. So in that Cutler Hill surgery, he said to me, well, the patient needs to be, I'm like, I need to see patients, what they're talking about. I need to assess them. I say, in fact, I'm not concerned losing a license but not doing proper assessment then because they are wearing mask. I'll take responsibilities. So it kind of something clicked in him. So he realized something is not right. Because do you know how many like anxious patients they can hide about, and then go and do something? You need to properly assess people. You have to have some sort of connection. You can feel something, like you said, you can feel something not right.
And some patients just need to be spoken to, with, and then others when I worked and I was allowed to see patients, because when they realized I was not vaccinated, they stopped me seeing patients face to face.
Wow.
I was like, okay, if you want to do more home visits, fine by me. But my training has been jeopardized, so you fix that. Fix my training. That was a few days after, they were like, no, they like super panicky tone. They were like, because I was seeing a patient that morning, and they were like, oh, I've seen someone. I was like, yeah. They're like, oh, afterwards, can you just talk to me? And I was like, okay. I was like, I didn't do anything wrong. Like, or maybe I did. Did I prescribe something like at the wrong dose or something? Did I give steroids in grams? Like, you know what I mean? So
Yeah.
I was like, no, I'm quite thorough. So then they were like, no, you can't see patients because we had a decision. I was like, okay, so without me, and you didn't involve other people who are who are helping me teach. Fine, your practice. But what am I training? They're like, oh yeah, you can do on like phone and things like that. I was like, that's not the same. But I said, okay, because I think I had too much on my plate already, and I just wanted to see what's going on. But later on, I brought it up. But it's very funny. It's like, and I felt that kind of alienation at that point. It's like, you're not in my group. It's fine. But what they don't know about me is like, I don't, even since a kid, I don't like to be in groups. Like, I'm like alone. I like to learn, understand. I have loads of friends from different groups. I'm not in this thing. So I'm like, all right, cool. Like, I don't mind. Like, whatever. Like, you know what I mean? Like, fine. This is easy for me. It's easy for me.
I have the same thing.
Yeah.
It's like, okay.
Yeah. It's fine for me. If you don't want me to come to your shop, cool. Like, go a different one. Like, all right. Like, same with the thing. But I felt it very unfair and, and discriminatory. But I learned a lot about people in the last 3 years, and then also a lot about myself. And I've come out of it very grateful for these things, because I felt like I've learned a lifetime's worth of information in such a short period of time. So many things have happened, and I've delved into it, and it's like I've been fast tracked onto this just new way of thinking. My mind's been morphed, and I can see like the fear in people, and I can see like how unfair people are. I can see why genocides start. Because before it was just like, oh, why? I read books like, why are people so mean? It's not being mean, it's something deeper than that. But I was like, fast forwarded it in a very short amount of time. And then like I've met people like you and other people that will be speaking on the podcast, kind of Alex and other vaccine-injured individuals who even though they're from different backgrounds, I share a similar thread and energy with them. There's like this I can empathize and sympathize what they've been through, because it's more than what the physical aspect is. That feeling, like you said, when they told you can't, it's like you're like a child again. Like, I know that feeling. And then also being left out and being kind of prosecuted for just telling the truth, for just being you. And then also there's a deeper aspect of like, we stood up and we did that because actually we realized that we are more than this, and there's something much more greater than this, and we need to move forward. And I think that underlying thread, I sense that with certain individuals now, which is very now, because before I was like alone in this maze. I was like, oh my god, you know what I mean? But now it's like amazing. I can meet people like you, and I can totally get what you're saying. But before, I would tell people they'd either have like a total kind of glazed look. They'd be like, oh, right. Yeah, that must have been really bad, or just like, okay, they don't get the significance of the thing. And even now, I wrote this book and stuff, and I would tell people, and they would be like, oh, how did you write the book? But never actually about the book. I was like, no, the point of the thing is the information within it is the most thing. So, but then I can talk to you and other people, and we kind of get each other kind of straight away, even the energy, even in your eyes maybe, or even in, you know, the way you talk. It's like finally, like we need to come together and share the love and change these systems, because there's a problem in the system made by the individual because of the fear. And then when you abolish the fear, my God, it becomes amazing. You know, it becomes just, life becomes more colorful.
Amazing, because I know, because working in NHS, I saw very good people over there. How they give, you know, I've seen really good nurses. I've seen actually empathetic doctors and what have you. Not the, you know, little man syndrome or whatever. I'm sorry, but you know, when they are just wanted too much power, the nurse never became a doctor, wants to just show. It's just, there's no necessity to do that. It's just like, I don't understand this politics myself, because you're here to doing your best and helping others, you know, but at the same time, when you with others, helping others, make sure you give help or love enough to yourself, because sometimes it could be, you know, we're all connected, we're all interconnected, yet like even me by myself, but you doing something good, it affects me in a good way. Do you understand how happy I was when I saw that the what you did? I'm like, yes. Do you know,
It's
it's
the
like
same feeling when I read your newspaper article of like Doctor Who refused to go on the plane. I was like, oh my God, finally! Like there's
refused a mask. It wasn't in the
yeah.
plane.
Sorry, refuse the
He
mask. Refuse the mask. Yeah.
Yeah, they didn't publish that one. They didn't publish even whatever I said to them about Heathrow Airport, because I took them to the court. They were interesting. I don't care. You know, they contact me. I gave the info. It was getting it too much, because yeah, you know, when like from every single part of your life, it's just attacks going. Yeah, and you staying positive, and you know, like, but it comes to you and it's hard. But through that hardness, something else come to him, like, oh, all right. Maybe it is somebody looking after him, because it was pretty hard. And so I'm like I tell you the truth, because stop telling the truth. I think that's what happened to people when they keep the truth, and all what's happening around them inside them. It's a trauma, and that's why people become ill. You know, because it's kind of eat them alive. All of this, you've done the work, you've seen what's happened. Lots of things is just psychological, and obviously the knowledge, because exactly NHS, they bring in us chocolate, and you're like, do you know what is in that chocolate? You don't eat organic chocolate or something nice made from cacao, you know, organic stuff. You eat so much chemicals over there. And how nurse, you can say like 50 or 60. I think it's more, depends where you're going. They're all obese. What sort of healthcare do you know? Or you go see a doctor, he's saying to you, he's so fat, he's saying to you, like, start taking statins, which, you know, statins are pretty, there is so much court cases going on, and you're like, why would you even take advice from him? Why would you?
Yeah, no, it's quite funny. I have 2 points. One is this kind of the statin thing. I mean, I've written a short guide on cholesterol and the actual cause of heart disease and stuff. And this is before the pandemic. And I remember as a GP trainee, there was a patient, and the cholesterol was, it was like an 87-year-old woman, and they had high cholesterol, but they had high kind of HDL and LDL, and they were fine. Everything else was good and healthy.
87 is pretty good.
So amazing.
Right?
And the doctor was like, oh, maybe next time we can talk about maybe statins. And I was like, okay. I was listening. And then they said also maybe ask them to reduce any cholesterol in their food. So I had to bite my tongue. So that's one muscle, the kind of strongest muscle in my body is the one that can not say things, because I think I always say, is it going to change anything? No. And actually it might cause like a sort of conflict in that point, huh?
Yeah.
Yeah.
Of harm.
So I've done the research, and I was like, in my head, high HDL and high levels of cholesterol are actually correlated with longer life. Okay, number one, it's metabolic health at the same time. So if you have an high kind of HbA1c, that can cause a high LDL as a reflection. So actually, a lot of the time, there's poor metabolic health because we're using different kind of energy pathways, and the cholesterol goes high. But it's the type of LDL. So you can have oxidized LDL, small, dense LDL, large and big. Large and big is safe. So this woman is old. is fine. And also, eating cholesterol has been shown not to affect your levels of cholesterol because the body regulates it. And I actually did my own self-experiment by eating 12 eggs a day for 30 days. And I looked at my cholesterol numbers and my testosterone. There was no change. There was no significant change in kind of either of these things.
But cholesterol is base of all the hormones.
Literally. So you need it.
All of it.
Yeah.
Yes, exactly. You actually need that.
Yes.
And for the nerve cells too. Everything. You need that.
Yes.
You realize people with the low cholesterol have a, the cognitive problem. That's what dementia, and they're giving cholesterol. It's such a big lie.
Yeah, yes. And also coenzyme Q10 is needed. So you need cholesterol to make it. But coenzyme Q10 helps with heart health. So you're going against by giving statins. I think maybe statins have maybe second prevention by an and maybe an antioxidant property, maybe. And also I think intermittently, maybe, because some medicinal mushrooms have natural kind of statins in, and maybe intermittently okay, but giving a constant dose of a thing for, when you look at the risk, the amount it actually reduces, it's very minimal. So I was biting all this down and I was like, I don't belong here. I really don't belong here.
No.
And the second thing I wanted to bring up was maybe let's see if you get this. The more and more I find myself in kind of alignment, let's say, so I am doing what I say. I am, so even if it's difficult or not, if I feel it, I will do it, whether it's kind of traveling to someone or writing a book or making a podcast. Even going for a walk. If I say I'm going to do it and I want to do it, that's what I will do. And I've been doing it much more difficult things, like if I'm not wearing a mask, I'm not. If I'm not taking a thing, I'm not. And that caused a lot of conflict and suffering with not just me, but family, and I had to leave job and all these things. But that gives not only you a sense of confidence and integrity, but I feel healthier.
Yeah.
And then I feel like on a cellular level, I feel like I'm more kind of aligned, because now I always say you can't listen to your gut if you have gut problems. So if there's a dysbiosis in the gut, this gut feeling is not very strong. But if there is an alignment in the gut, an alignment if you're exercising and you're healthy as well, because when you understand it and doing what you say, and your kind of body says you need to exercise today, but it's raining, but your body says you need to exercise, but you go and exercise. Now you're looking after yourself because you're just doing what you're saying, right? So eventually that causes an alignment. And I feel at moments I'm not really thinking. I'm like in this state where thought is very kind of reduced, and it's just my heart kind of taking me places. And sounds weird, but at those moments, I feel like a deeper connection to everything.
Yes.
I feel like more of an alignment to everything else as well.
Because heart has a magnetic field and has a brain on its own. Plus your gut have it, but that's why they're destroying our guts with all the statins, the heavy metals, causing leaky bowel syndrome, which is reduce our immune system and liver, all of it, just a madness. It's like the whole is interconnected. We can treat, we can heal without anything, to be fair. The human body is so... When you read, like, you find out what they did and what have you, just a belief system, how it can change things in your body. And it's been evidence-based. I mean, if you're looking at one of the Professor Garayev, he was talking about epigenetics and how he did things, he regenerated actually pancreas. All of his studies, Canadian removed, so he went back to Russia and kind of, people die with the trauma happening and be treated unfairly and took all the life's work and what have you. There is so much knowledge out there.
So much.
And, we're just stuck in this allopathic. It's boring.
It's the medical kind of industrial complex, which is there to make us sick so they can sell their product, where if you have individuals who want to heal, so not doctors anymore, actual healers, let's say, then it doesn't fit the corporate greed factory system, because this healthy person is an unprofitable person. They can't make money. But if you give
Yeah.
someone statins and antibiotic medication and all these things, and they're on 50 medication for 50 years of their life, and they die at like 70, but in a terrible state, someone's making a lot of money until they
Yes.
die. But the patient's still sick. Nothing
Mhm.
has changed. I think health, we are astoundingly able to heal ourselves, but we need the right stimuli and the right amounts at the right time, and we have to work in a 4-dimensional way and not in a 1-dimensional way. But also, it's not only in supplement form. I think there's use other forms like light, talking,
Yeah.
other things which we kind of look down on, and then I think it's a bigger question of, okay, we realize everyone's telling you a lie, so now we have to really look within and go, what am I being kind of biased against? So even I'm like, surely that won't work, and then I go, well, no, let me explore, let me be open-minded now, because I'm kind of bored of the healthcare model. It's amazing to treat a broken limb, or kind of things you
Yes.
find in
Uh,
short-term stuff. But
Mm.
I always say, if healthcare is so amazing, why is 1 in 2 people having cancer? Why 1 in 3 have depression? Why are more people dying now ever? Young people, like, obviously something's wrong.
Well, I know why it's
Oh
happening.
yes, we do.
Like
100%.
someone is like
We know.
it's like in front of us, and we know. And I've seen patients come and actually telling me, even that short period ish, like, like one day, different surgery, they will know that, and they will slowly blacklisted me. But anyway, you just go and you see what happened.
Hmm.
It's no other explanation. Do you understand what I'm saying? That's the only different things they have, including death at a young age.
When did you leave? When did you? So you're not actually working now, or?
No, I'm on sick leave because of the numerous court cases and
Okay.
trouble with the police and what have you. It's basically threw me off to
And
the
then,
level.
and then when you did work, were you seeing side effects and deaths kind of
Yeah.
related? Yeah. And what did you bring it up to your colleagues?
No, because as a GP, you're independent practitioner, so I've written everything in the notes.
Yeah.
You understand, because I've said, like, had this. I've written. So even when I was working for Public Health England, the care homes will tell me what exactly happened, and I'm collecting data ish, right? So we have this much vaccinated, but now they're doing a PCR test. They'll ill. They ill more than we were doing prior to that. Because I've been working. I'm just collecting data. I'm not just saying things, right? I actually, it's through my experiences, and I'm not doing it. I've already collected. What's going on. Every single consultant in that place know what's going on, but they're still saying, "Oh, you should have a V." No, no, no. I took my child to have it. Consultant in public health, and I felt not on. I felt pain. To be fair, you're taking your child to have something told you that is good. You can see in with your eyes it's not good, but you're making sure that it was painful. It was really, really painful.
Yeah. I mean, when just before they introduced or they were thinking of introducing it to children, I wrote to the GMC an open letter.
What? Yeah.
An open letter,
What?
wrote it, and I looked at their policies, and I was like, "Okay, doctors should be caring, should be looking at recent data." So I wrote it in a way with the data for children, and I said children should not be getting this. It's all risk, no benefit. And I wrote
Yes.
it so they couldn't, because I was still a doctor, so they couldn't kind of deregister me. And then I put
Yeah.
it up on a platform. That got taken down, and I later found out that kind of Bill Gates was in charge of that website, and then the GMC responded a few days later saying, "Oh, it's not really in our hands. It's vaccines are, the government policy, and I'm sure they'll be fine." Something very generic like that, and I was like, "We are gone like this." The people who are supposed to be protecting,
Yeah.
patients, that's your job.
Yeah.
They're literally your
Yeah.
job, and our job is
Yes.
also to, safeguard. If
But
a
they are
child comes
regulating
in
body, isn't it? So make sure that doctors,
acting
protect.
safely, yeah,
Yeah.
then it's not the fact that they don't know, because now I'm giving you the information, all kind of evidence based. So it's not like the information's not there. It's something deeper. It's something you don't want to see it, or your hands are tied, or you enjoy it. I have no idea. But then the people with regulatory body are supposed to look after patients, and then doctors who are the gatekeepers of health. So if you saw a child with a beaten up face come in, it's your duty to call the social services and the police, because something's going on. But in the vaccines, and they cause death, why not?
I know, and even last time when I went to the surgery, I'm telling you, that was the 31st of March, because that was the last time, and then they treated me, whatever. So every single patient in my surgery was because of it. And they would tell me, and I say, yes, I believe you. And they would cry because somebody believed them, because they go to this doctor and this, that, bilateral PE after booster. Like, how else are you going to explain that? We knew what, they admitted themselves it's a polysorbate 18 and polyethylene glycol, which causes all these tromps and whatever, clotting. However, they've admitted that themselves, because I read their own stuff to see how legally I can help people, because I used to give exemption in Australia, I used to give green passes, and they removed my registration, and then like how to do it, because that was the truth.
So
because they admitted that as well.
So the patients knew, obviously, because for people who don't know, like a bilateral PE is, you don't really see that. It's very rare, and it's usually with like underlying conditions on top of cancer and things like that, and in an old person. But I know
bilateral. Do you understand what I'm saying? It's a bilaterally, like, how is it that working? It's just.
So did you see any other problems?
Oh yeah, with the pregnancies, with the bleeding, colics, and then having I've seen it all. I'm saying it's just even short period where I've been there. I don't know. It's like universe was showing me what I'm thinking, what I know, and it's kind of giving me kind of examples what happened. And the whole surgery was like that. Neurological problems all happened after that. I had a patient who was scared, who wouldn't do it because his friend died at the age of 16. It was a young age, so I'm like, I was happy that the guy was scared, so he won't do it. Won't harm himself because of seeing this. But they just denying these patients, not tell the truth. That's another trauma. Imagine you come into doctor saying this is this, and they say no, it can't be. No, it can't. It's never happened.
I mean, when I was working and I was seeing side effects, I was seeing like missed periods, random extreme inflammation, and then worse after COVID. And then the patients, even them, they were like in this zombified state as well, because they were like, it might be the vaccines, but I'm thinking of getting the next one. I was like, and because I'm not allowed to say no, and I'm trainee as well, and if you question it, they would, So I was like, are you sure? Have you done your research? Really making them think. And the one was one was a woman who wanted to get her son vaccinated. And I was like, are you really sure? And I give them the evidence, like, children don't get it, blah, blah. I was like, I think you might want to think about it, and we can have a discussion later. I mean, did you see cancers?
Well, I didn't come to that point. Actually, no, I've seen a cancer. That was a breast one. It happened after that point. But what I've come across is first round, it was lots of neurological stuff. They were in constant find anything. That was when I was doing Cutler Hill in 2021. It's funny the way it goes, right? Depends on a date. It's like proper experiment, right? Then I saw this patient. I remember that was end of or beginning 2021. She never blood pressure issues, and that also was happening because I had some friends, students that were studying at King's College, where my friend was at the time doing a master's in dermatology. So all the students around, they had blood pressure issue. They developed high blood pressure in students. Yeah. And obviously they were sick afterwards and developing this, that, and another. He was telling them what it is, because we had the same view. They're completely ignoring it, even though he's a qualified doctor. And they were like, I don't know, politics student or some other stuff, proper geeks, sorry, doing with doing with computer or some politics stuff. I don't know. So, but doctor telling them, right? This is they still went and did it. I don't understand this. I couldn't get it.
Yeah, I mean, me too. I mean, as family members, I was like, don't get it. And not to, if it's not coming from me boasting, but my independent life, like the research, the fact because I was frontline, but then also reading. I like in the last kind of 3 years, I read over 2,000 studies, or like referenced in the book. So it was like, okay, listen to Fauci then.
Yeah.
Or, because maybe I didn't fit and I'm trying to move away from the look of the doctor. I'm trying to move away from the tie and the suit and the kind of stethoscope around the neck. I'm trying to be like, open your mind a little bit more to other perspectives. So they must start with me. But maybe I didn't have backing. Maybe if there was 10 other doctors like me saying, I don't know. But patients were they were stuck, and a lot of them are. Did you see any myocarditis?
No, not myocarditis. I've seen pericarditis, not that way. While I was given exemptions in Australia, especially Perth, might just have to write the book too.
Yeah, you should.
So much happened. It's not even writing exactly, just telling what happened.
Just do a movie.
Actually, yeah. So, honestly, this poor child had a pericarditis after the second. He was 16, going to 17. So obviously, I've written exemption. I don't know, and then they removed my license, and then they told them, by the way, I follow every single rule by them. Correct. They're trying to now make me as a fraud. Yes. Even though it's a corona time, Zoom consultation it is, I am FRA CGP, which that's the highest one you should have to give exemption, yeah, in Australia. If you with the Royal Day College of GPs, and I did all of the things they asked me to, then work there for 2.5 years. They basically, and I still have a registration because they are the one who gave that to me, dealing with the COVID things. So people start getting it. So the government starts stopping me and every sort of remove everything, and they started writing patients. So the patient spoke to me, and I'm like, do something about it. Ask for compensation, because he developed pericarditis. You know what they told this poor guy? Saying, oh, he didn't stay in A&E for more than 24 hours, you can't claim the compensation. Do you understand what they're doing to these people? And they're taking it. How else I'm going to, like, you come to the point when you try to help them, by doing all of this. Don't get me wrong. I've also asked for the because I didn't work in, nobody will tell me. But I'm telling them what to do, giving them legal stuff, teaching them, without constant telling how it's supposed to be done. They still sit down and not do anything. What is the point? That's when I'm just like, it's good when they removed my license. In a way, if you think about it, they have to stand up and say no.
Yeah.
I can't just do it for you. I told you all the legalities. You can see the bullet. I've lost my license because of you people.
I mean, firstly, thank you so much, and I think there will be a good number of people who will be so grateful that you stood up and you did the right thing, and everyone else was saying don't do it, and you saved people's lives, and that was your job.
Yeah.
And others, you can't make people see. They have to see themselves. But you can make them. You can direct them to a path that they might maybe stumble upon the truth, but you can never lead them the way. And so that's unfortunate when it comes to their health. I mean, it goes so deep. I mean, when I was leaving, and they were talking at house meetings and stuff, one of the doctors who asked was like, "Why don't you take the shot?" They themselves had myocarditis, and they were on long-term medications. And I was like,
"Ish, for real."
I was like,
You're
is this?
afraid to just leave that way too, well done, just like, I
Mm.
don't care anymore, bye. I think it's great.
I just felt like I had no other choice, because you know what I mean? It's like you've exhausted your thinking. You're like, you kind of know deep down, like, this is the only choice, You either live a lie, and or take the intervention and risk it, and maybe not risk it, and that's still, you live a lie, a deep lie. That's, imagine knowing all this and then living with that and hearing children scream. I just couldn't. So I was like, I can't. I'll find a way to live. That's okay, but I can't do this. But wow, the fact that you were giving exemptions and stuff, it was just amazing. This is like
That was one here, so it wasn't, that was Australian here.
Yeah.
That I had doctors, oh no, patient group, basically. I was giving them, and patient just giving charity to me, and it got too much, just signing this, and it wasn't the right things, and then introduce NHS form. So I had to study, yes, how to. So it's all legally. That's why they actually published my article in the newspaper about me, because it, it's legally, like they said, I didn't do anything against anybody. I just protected myself and my patients.
Yeah, that's the thing that they forget to take into consideration, that these individuals like you or me, we're not just screaming and shouting with no basis. Like, we have deep knowledge and we understand the system. Therefore, we do things the right way, and we always have. So messing with us is really not going to be favorable in your case. Like, all the boxes that need to be ticked have been ticked, and we've done the right thing, and you've done the most right thing by telling people not to take it from the start, by giving exemptions. Like, you followed your oath, but more than the oath, you followed being a human being. You followed this thing, which is yeah.
Thank
which is everyone should be doing. But it's a sad fact that I'm congratulating you for doing your job. This is what I've been saying from the start. If the doctors have done their job, if the journalists have done their job, and lawyers have done their job, just do your job. Nothing else.
Yes.
You wouldn't be here. You wouldn't be here.
We wouldn't be in this situation. Literally, like, you've been taught to do this, like, be a normal human. But what I realized, even with the new medical, it's all about brainwashing, following politics, guidance, and it's like, how about science? How actually about the things?
The actual science, yeah.
I didn't come exactly. You are absolutely right. I didn't come here to be a politician. If I wanted to be a politician, I would become politician.
Yeah.
And I wouldn't, because I can't lie. Literally,
Same.
that was my.
Same.
It's like, it's a very big issue for me.
I'd only like to save someone, but never. And even then, I'll do it in the right way. It's like, yeah, I have this thing, I can't. I want to ask, what about your colleagues? Are you seeing anyone being unwell? Because the medics have taken like 5, or 4 or 5.
Oh no, for real.
I don't know.
haven't seen it.
So doctors haven't, or have they?
I kind of haven't had any colleagues after that. I have some friends left. One of them taken, she's fine, thank goodness. And another one, I actually, because I, at the beginning when we work, I told him what I think about all of this. So he started thinking, it was good. I'm pretty happy. I think I have a delivery. Sorry, Ish.
That's okay, don't worry.
Just gonna ask my son to pick that up. Hey, probably here. So but others, like, kind of disappeared from my. So the only people I've seen, my colleagues, were pretty good in public. I dearly miss them, because they still, on my, I would tell you, that was the most truthful, multi-source, like, a feedback, the questionnaire, when they're doing it. They're all written that, I know my stuff, but they can't understand why I don't get the vaccine, basically. That's what it is. But it was so honest. I love what, because they've been brainwashed, that's all. But they all had so many COVID afterwards, had menstrual problem afterwards, have all the shaking, all the, usual arm pain or what have you, having all of the stuff, still went and did the booster.
Yeah, I think the biggest side effect I've noticed was they were just getting COVID again and again. So
Yeah.
like even in the surgery, the young ones were getting COVID. So we had like a lack of doctors, and I was finally, they didn't make me see patients, but I've not taken sick leave for around, since the time working the pandemic to when I left. So I was actually the most efficient worker, and I didn't have brain fog and other things like that. But they were like, no, we don't want you. We want these people who are going to be more sick. I was like, this makes no sense whatsoever. And you come to a stage where you feel kind of helpless because you're like, you have deeply want people not to take this, but they won't listen.
We know when I became like that, I have to admit, because right now I'm like, I can't do anything. It's just their choice. So it was September or October. I went to police with a group of people, like, who is keep shouting. So it's a police station, and this is a vaccination center. So I went to the police, report a crime, because at the time Dr. Malhotra already came out with the article that doctors been disinformed. So I'm talking to this police guy, and he went and spoke to inspector whatever Cox, or more like a dick, sorry. And then he said today we don't accept any more crimes, right? Exactly. And I'm like, we've been misinformed, and these things are actually causing issues. So it's a criminal investigation, has to be. And when they said that, I said, well, everyone personally liable. What are you guys doing? Remember, I've warned you. I said I'm a GP. I work for Public Health England. So, and then when we went out, we just see people willingly, all right, going through that vaccination center, whatever. Number 6 or 7 or 8, I don't know, ish. I don't know what, like how much are you going to do. It was that when that was helpless, not only, but it's just, you know what, I've done my best.
Yeah, I know.
Do anything else.
That's the thing, because even like, I have family who know I left because of this. So they knew the extent of the how much I felt, but they still went and got it.
I'm sorry, I know.
So it's like, I can't really blame them, because the amount of propaganda is massive. Because it starts from this kind of school age. You listen to a doctor because the doctor knows best.
Yeah.
This is a science. You have to put your hand up if you want to listen to the teacher. All the way up to clap for the NHS. People falling down randomly in China. The news presenters wearing like full double PPE, but the nurse is not wearing anything. Fear everywhere, and fear itself kind of scrambles the brain and the kind of prefrontal cortex, and you can't think very straight. So all of this, that's why lots of people are now like, they can't recollect the last 2 years, because they've been in this kind of traumatic state, because of fear. So
Constant fear,
and it rots the brain, and it makes you it makes you zombified. So you look for the quickest answer. So I get all of that, man. I understand, and I deep down I feel very angry only at the people who have tricked us, but just really sorry about everyone who's taken it, because no one who's taken it thinks, wow, it's amazing, it's the best thing. And if they do, they've either paid for, someone's either paying them, or they've been brainwashed. And nearly everyone I've spoken to are regretful, and you can see in their eyes they're regretful. If I bring this up, my book up, or what I'm doing now, there's an uncomfortable feeling in the air, and I'm not here to make people uncomfortable. I don't want another pandemic. B, I don't want medical tyranny.
Exactly.
I don't want the collapse of health, science, and ethical standards over the last 3 years is actually criminal. And the only way we sort this out and find any cures or vaccines for people with COVID is by looking at it. like we do ourselves with our trauma, we have to face that fear.
Yeah.
Now, if not, we're going to have another one. We're going to have another 10. We're going to have, because if they can make one in the lab, what's going to stop them making another?
Exactly.
You know what I mean? If nothing's done,
yeah, I do.
right? And the same response again. And some
Mhm.
people, even some people will have an injury and still be like, oh, fine, I'll get another one. Because it's so
No,
strong with propaganda. Like,
I
it's so
know.
strong, the conditioning.
But I have to point out this fact, okay? UKHSA, because they changed from Public Health England, right? To just see how deep it's run in that, it's called so Health Security Agency now, right? So why do they employ so many behavioral psychologists? It's there. They're actually saying that why do you need behavioral psychologists? Why do you need behavioral psychology in the middle of pandemic? Please explain that to me. Not real science, virologists, whatever. They get all sorts of things because I've seen what they bring.
Yeah, and they've got the nudge unit, and they and one of the lead scientists in this behavioral scientist is a known communist. Like, so, and also you have to remember, the government doesn't care about your welfare or your health. No one does. Only you can. Only you can. The government only promotes things that they will actually benefit them, whether it's immediate or later, whether it's a war or not, whether it's land grabbing or an infrastructure grabbing or the minds of people or increased tax or anything. They will do something, because if not, we could live in utopia right now. I genuinely believe we can live in peace. Wars exist. There's only war because wars make money. You know, if people actually understood the concept of war and understood actually if every mother and father told their son never go to war because you're worth so much more, you could end wars straight away.
Yeah, absolutely. I am agreeing with you. It's all about, you follow the basically money every time, everywhere. It's a divide people so they can control easier in every Holocaust, genocide, or whatever. Then and
it becomes because I think money is actually for power, right? And it becomes like a runaway thing. So every genocide will collapse, every communist state will collapse or has collapsed because the government start implementing these things and they form a genocide. But eventually, people either wake up, realize, there's too many deaths, and then the whole thing falls, and and then there's a revolution or something, and then we think it's all good, and we have this massive party, but unnecessary amounts, millions of people have been killed in the process, and then a few years later, in another country somewhere, or now kind of globally, it happens again. So we go, we haven't learned anything. So I think for me, the most important message is not even about COVID or about the pandemic. It's we need to stop this divide, come together. This red versus blue, unvaxxed versus vax. I've got this many. You've got this many. He said this last time. We need to start to forgive deeply, and come together and really look at who in the last few years have been kind of pulling the strings as a world. Not just as a team, and stop. I really despise just talking about things. Talking about things is good. I think in a group situation is good, but I need to see action. I need to see things happen. I need to see, have you banded together with your doctors and left your careers and actually made such a fuss that the news can pick something new. If 50 doctors left, made a group and just left, it'll be on the news.
Yeah.
So you need to think, what can I do? Not just talk, because talking is great, yes, but after a while it just becomes talking, and every day someone is dying, or hundreds of people are dying every day unnecessarily, and we can stop these people dying. So, I mean, this is why this podcast. I don't know what happened there. Technology plus fun, because yeah, go on.
Can you hear me?
Yeah, I can. So can you hear me?
I don't think I can hear you. Hello?
I can hear me now.
I think
You can hear me.
I can't hear you. Let's finish this. The universe telling us to stop talking.